Nasal allergies can often cause coughing as a symptom, and treating the underlying allergy can help alleviate the cough. Here are some potential treatments for allergy-induced cough. Avoid allergens. Identify and avoid triggers that cause your allergy symptoms. This can include avoiding outdoor allergens like pollen, staying indoors during peak allergy seasons, using air purifiers, and avoiding cigarette smoke and other irritants. Antihistamines. Antihistamines like loratadine, cetirizine, and fexofenadine can help block the effects of histamine, which can reduce allergy symptoms like coughing, sneezing, and itching. Decongestants. Decongestants like pseudoephedrine and phenylephrine can help relieve nasal congestion and reduce post-nasal drip, which can contribute to coughing. Nasal corticosteroids. Nasal corticosteroid sprays like fluticasone, mometasone, and budesonide can help reduce inflammation in the nasal passages and decrease allergy symptoms like coughing. Immunotherapy. Allergy shots or sublingual immunotherapy (SLIT) can help desensitize your immune system to allergens and reduce allergy symptoms over time. It's important to consult with a healthcare provider to determine the best treatment plan for your individual needs and to ensure proper diagnosis of the underlying cause of your cough.